We are at Hanson Place Seventh-day Adventist Church with Greater for New York City for Change Policy Director Tim Foley, who is conducting a healthcare reform teach-in for concerned voters. People are here to find out if healthcare reform is still worth fighting for and winning this year. What's all this talk about reconciliation and sidecars? Did the White House summit actually change anything about the politics or the policy? While media coverage is full of speculation, many Americans are still left in the dark, which makes teach-ins like this one so important for concerned citizens and healthcare reform activists. Who can cut through the clutter and get back to the basics? What's really on the table? How would the bills in Congress rein in the abuses of the insurance industry, increase coverage, lower cost, and give high-quality healthcare to millions of Americans? I'm pleased to be here with Tim Foley. Tim has been conducting many healthcare reform teach-ins to shed a little light on this complex subject. Thank you, Tim.
Thanks, Stephen.
Recently, the media and many in Congress had pronounced healthcare reform dead. President Obama's bipartisan summit revived this initiative by calling for a straight up and down vote in the House on healthcare, with additional legislation consisting of many fixes for the Senate bill. Is this just another chapter in the healthcare reform battle, or is this a real opportunity for this maneuver to work?
Well, there's a fantastic possibility for this maneuver to work. And in fact, anyone in the insurance industry who's ready to pop open champagne corks thinking that they've got this finished off is dead wrong. We're on the 2-yard line. We've got 2 weeks to go. This reconciliation maneuver has been used dozens of times in the past by Republicans and Democrats. It's precisely used for the sort of thing that we're about to use it for, which is fixing past legislation in a way that will actually help bring down the deficit more and manage the budget even better. That's something that we have to do with healthcare, because the single biggest drivers of the deficit for years have been Medicare and Medicaid costs. And in fact, COBRA, which is the plan that allows folks who have lost their insurance to continue staying on their employer's insurance even though they've switched jobs. The BR in COBRA stands for budget reconciliation. So not only is it possible, but it's actually our best bet yet of passing the Senate bill and then fixing some of the less desirable elements of it in a way that's completely abiding by the rules and can really get this done in time for 2010.
Is reconciliation the endgame for healthcare reform, or is the healthcare reform bill a work in progress?
Well, I have to say that the answer is both. Reconciliation is the way to get this bill done. And actually, it's specifically to fix parts of the Senate bill that aren't working as well as they should be because of the various deals you had to pass to get 60 votes. We don't have to get 60 votes. We can get a simple up or down majority of 51, and reconciliation is the way to fix the bill that's already come before. But it really needs to be the starting point. I like to talk about France. France has the best healthcare system in terms of customer satisfaction. It has one of the best in terms of keeping people healthy, in terms of longevity of the folks who are working within that system, and something called amenable mortality, how much medicine actually makes them better. And so the French justifiably love their healthcare system, but they change it all the time. There's a major healthcare reform initiative every 5 years. Why? Medicine's always changing, and they're always looking for ways to make it better. By contrast, we have the lowest life expectancy of any country in the Western world. We spend far more than any country in the Western world. We're the least satisfied with our healthcare system of any country in the Western world. We hate our healthcare system and we refuse to change it. The point is to get us to the point where we're making minor reforms and changes all the time, and these bills taken together give us the framework to do that far into the future.
In your opinion, what are some of the best initiatives in the current healthcare proposal?
Well, there's a lot to like in this healthcare reform proposal, and there's a lot that really directly impacts people's lives in New York, in Brooklyn, in New York State, and in the country as a whole. But fundamentally, healthcare is about making healthcare fairer, giving more people access to it, and getting our costs under control. The health insurance regulations involving pre-existing conditions, no longer charging people different rates because they're a woman or because of their age or because of their health status or because they happen to be in a dangerous occupation like a police officer or a minor, those are changes that are long overdue. putting initiatives in place, particularly in Medicare and Medicaid, to start to bring costs under control. So we're paying for quality of care and not just quantity, the way our current system is set up, and to encourage doctors and other health providers to collaborate together. We know how to do that. The VA already does that. The Mayo Clinic already does that. It's about time the rest of our healthcare system, particularly those who use Medicare, started doing the same thing, so we're getting value for the money that we're spending. And then finally, it's about access. This bill would add 15 million people to Medicaid, which is a proven program that most people in most states don't have access to, even if they're working poor. It would also give people a chance to have health insurance that's not just as good as what a member of Congress has, but exactly the same as a member of Congress has. And I think that's long overdue, and it would give people a way that they could pay for it through tax subsidies that would put it within reach of most families' budgets. All of these steps, we know how to do them. It's just a question of having the will to actually do so. Once this bill passes, that's going to become our new reality.
Will progressives in Congress and across the nation accept a final bill without the public option as a necessary compromise? And will they continue to actively push President Obama's agenda?
It's hard to say on the public option because there are 40 senators who have signed on to a letter saying that they would pass a reconciliation bill that contains a public option and do it this year. They need 51 to make that happen. But here's the thing about the public option. They need 51 to make that happen next year, or the year after, or the year after that. The public option in the bill wouldn't have even been triggered until 2014. So it's entirely possible that this particular bill passes without it, but then it gets added in a future legislative action. The only way to make that even remotely possible, though, is passing the bill that we have right now. The reason for that is success breeds success. If they're able to successfully reform healthcare and the public recognizes that, that gives them the space to continue fixing it with things like a public option, maybe even a public option with Medicare rates. If they fail now, no Democrat is going to touch healthcare reform for another 15 years. We've seen how that movie ends.
What main points do you hope for people to get out of tonight's teach-in, and what actions can citizens take?
First of all, I hope that they take with them an appreciation of exactly how much good is in this bill. We spend a lot of time talking about the controversy and the process and the politics, but we don't really spend a lot of time talking about how this is going to impact people that they know in their neighborhood, their family, their friends, people in other states who they know. We're lucky in that New York has some of these measures already, but even New York would stand to see a tremendous benefit from this. But second of all, what I really hope they take away is a sense that this is up to them. Members of Congress and the President, they work for us. And we elected them in a large part because they said, when it comes to problems that have vexed us for decades, I can actually work with people to get this done. Well, you know what? This is the exact set of circumstances in which we elected them to be there to make decisions like this and to get bills like this done. So it's time to call them and remind them that this is why we hired you in the first place, and let them know that there are going to be repercussions if they fail to get healthcare reform done this time.
Thank you, Tim.